Rising risk of deadly flu complication in young children. Acute necrotizing encephalopathy alert. Alarming rise in life-threatening flu complication puts children at risk nationwide. A dangerous and potentially fatal flu complication is striking more young children across the United States, sending shockwaves through the medical community. According to groundbreaking new research, cases of acute necrotizing encephalopathy, ANE, a severe condition causing potentially lethal brain inflammation, are occurring with disturbing frequency among children between ages 1 and 10. The comprehensive study, conducted by a collaborative team of 61 researchers from prestigious institutions nationwide, including Stanford University, documents an unprecedented surge in this rare but devastating illness. What we've compiled represents the largest collection of acute necrotizing encephalopathy cases ever documented in the United States, all emerging within just the past 2 flu seasons. Explained Dr. Keith Van Haren, pediatric neurologist at Stanford's Lucile Packard Children's Hospital and study co-author. ANE represents the most dangerous extreme of what influenza can potentially do to the human body. The statistics paint a troubling picture. While Packard Children's Hospital typically encounters only 1 ANE case every 1 to 2 years, they treated 4 patients during the 2024-25 flu season, a period that saw flu-related hospitalizations reach their highest levels in 15 years. Similar alarming increases were reported by hospitals throughout the country. But here's where it gets truly frightening. While millions of children contract influenza annually, and many experience mild brain inflammation as part of their immune response, ANE patients suffer such extreme swelling that cerebral herniation can occur, where brain tissue is forced through the skull due to intense pressure. The typical ANE patient is around 5 years old, and most shockingly, the majority were previously healthy children with no significant medical issues. The research revealed sobering outcomes. 27% of children hospitalized with ANE died from the condition, with cerebral herniation responsible for 90% of these fatalities. For survivors, recovery presents enormous challenges, though with promising possibilities. Surviving that critical first week is absolutely essential, Dr. Van Haren emphasized. If we can help children navigate those initial 7 extremely dangerous days, they have a genuine chance at achieving a reasonable recovery. The study found that patients who made it past the first week typically survived the disease, though 63% continued to experience moderate to severe disabilities 3 months later, including inability to sit, stand, or walk without assistance. Recovering from acute necrotizing encephalopathy is similar to recovering from a traumatic brain injury, Dr. Van Haren explained. It's a long, challenging process. Parents should watch for specific warning signs. High fevers following flu infection, coupled with sudden behavioral changes, particularly unusual drowsiness at times when children would normally be alert and active, such as mid-afternoon. Dr. Van Haren stressed that if these symptoms appear and parental instincts suggest something is seriously wrong, immediate emergency medical attention is crucial. The speed of intervention can literally mean the difference between life and death. The progression can be frighteningly rapid, he warned. A child can deteriorate from merely drowsy to critically endangered within just a couple of hours. Children diagnosed with ANE typically require immediate intensive care hospitalization lasting a week or longer. Current treatment approaches include steroid injections and plasma exchange procedures aimed at reducing brain inflammation. While these interventions have proven effective in preventing fatal cerebral herniations in most cases, Dr. Van Haren acknowledged that additional research is urgently needed to determine optimal treatment protocols. The underlying causes of ANE remain largely mysterious. However, Dr. Van Haren and his colleagues are investigating variations in a protein called RANBP2, found in the center of every human cell. This protein likely carries some genetic susceptibility to the disease, though not in a way that's currently detectable through standard screening. We see completely healthy individuals living normal lives until something like this strikes, and only then do they discover this condition might run in their family, he explained. The disease follows an autosomal dominant inheritance pattern, meaning only one parent needs to carry the gene for it to potentially affect their children. And this is the part most people miss. Vaccination status appears to play a crucial role in vulnerability. Only 16% of children diagnosed with ANE had received flu vaccination within the previous year, compared to 49.2% of children in the general population. Among the 38 patients with documented vaccination history, just 6 were fully vaccinated against influenza, Dr. Van Haren noted. The typical childhood vaccination rate is 40 to 50%. So 16% represents a significantly lower figure, strongly suggesting unvaccinated children face substantially higher risk. Interestingly, while most hospitalized ANE patients were white, Asian children were disproportionately affected, and the condition appears more prevalent in East Asian regions. The reasons remain unclear, but evidence suggests children of Asian descent may face elevated risk, Dr. Van Haren said. Ultimately, Dr. Van Haren offered 2 critical messages, one for parents and another for medical professionals. For parents, ensure your children receive flu vaccination, he urged. Influenza can cause complications far worse than the familiar fever, aches, and chills most associate with the illness. For healthcare providers, Dr. Van Haren hopes the research will catalyze development of more effective diagnostic and treatment protocols, given how rapidly ANE can become life-threatening. And I would strongly emphasize to clinicians, don't abandon hope for these severely affected children, he added. Their recoveries can sometimes exceed expectations. Aggressive early intensive care often yields significant long-term benefits. Do you believe flu vaccination should be mandatory for all children given these findings? Or should parents maintain the right to choose despite potential risks? Share your thoughts in the comments below. Originally published July 30th, 2025 at 11:12 a.m. PDT. Rare flu-related brain condition affects healthy kids. What you need to know. A shocking new study reveals a rare but severe neurological complication from the flu, primarily affecting healthy children. In the past 2 respiratory virus seasons, at least 41 cases of influenza-associated acute necrotizing encephalopathy, ANE, were reported in children, with a staggering 76% occurring in kids with no underlying medical conditions. This condition is associated with high mortality rates, 27%, and morbidity, leaving 63% of survivors with moderate to severe disabilities. But here's where it gets controversial. Deadly flu complication in children. Surge in cases. Importance of vaccination. The flu is often dismissed as a seasonal nuisance, but for a growing number of children, it can trigger a catastrophic and deadly neurological event. A groundbreaking new study has just shed light on a terrifying complication that is surging, leaving devastation in its wake, and prompting an urgent warning from medical experts. In a comprehensive report published Wednesday in the JAMA Network, researchers have detailed an alarming spike in cases of a rare but severe condition over the past 2 flu seasons. This collaborative effort, spearheaded by scientists at Stanford University and involving centers across the United States, provides the most detailed picture to date of this frightening trend. The condition is called influenza-associated acute necrotizing encephalopathy, ANE. To put it simply, when a child with this complication gets the flu, their own immune system can go into overdrive. Instead of just fighting the virus, it launches a runaway attack on the brain, causing massive, dangerous swelling. This is precisely the kind of severe outcome that doctors hope to prevent when they strongly advocate for flu vaccination, particularly for the most vulnerable, like young children. The vaccine doesn't just protect you against fever and chills, explains Dr. Keith Van Haren, the study's author and an associate professor of neurology and pediatrics at Stanford University's School of Medicine. It can protect you against much, much worse stuff. And here's where the story takes a concerning turn. During the 2023-24 and 2024-25 flu seasons, an unusually high number of children were diagnosed with ANE. Typically, we see cases like this once every couple of years, Dr. Van Haren noted. In the 2023-24 flu season, we saw, I think, maybe 1 or 2 cases here at Stanford. Realizing this was not an isolated event, he and his colleagues began reaching out. We started talking to other colleagues, and it was clear this was happening at other centers too, he said. Because ANE is not a condition that is systematically tracked by health agencies, identifying the scope of the problem required a massive coordinated effort. The researchers performed what one outside expert called a lot of legwork to manually collect data. Dr. Michael Wilson, a neurology professor at UCSF, who was not involved in the research, applauded the team for this difficult but crucial work. Ultimately, they identified 41 children who suffered from this severe neurologic condition between October 1st, 2023 and May 30th, 2025. The outcomes for these children were heartbreaking. About